Welcome to the May meeting of the Medicaid Client Voice Council. My name is Jason Peterson, Director of Constituent Services at DHS. All of our DHS presenters are here. Some of our council members are still going to be arriving. I think Jeralisa is still coming. Angelica is still coming. But we're going to get started because we have a full agenda today. You may have noticed more DHS leadership are here now than have been the past few meetings because the legislative session is over, and no one's happier than we are about that because it takes up a lot of our leadership's time and effort and attention, and so they are happy to rejoin us here at our Medicaid Client Voice Council meeting. We are going to learn a little bit about the legislative session, some of the things that happened that affected DHS or impact DHS in one way or another. So we'll have a legislative recap. That is going to take up actually all of the first half of our meeting until lunch. And then after lunch, I know a lot of you are excited to learn about our condensed application and the less repetition we're going to have in our application process. So Mary Franklin is going to join us to show you that application, show you the improvements that have made, largely based on some of the suggestions we've had from this council. So we're looking forward to learning a little bit about that. But since Secretary Christy Putnam is here with us today, I would like to invite her up and share a few words of welcome with you all. And then we'll have a word from our secretary or our chairperson and vice chairperson. Are you better with a microphone or with this?
No, this is fine. This is fine. Well, it's still morning. Good morning. Happy Tuesday. I'm Christy Putnam, and I have the honor and pleasure of serving as Secretary of Arkansas Department of Human Services. We have an incredible and amazing team, many of whom are with us this morning, so I'm glad that you all get to hear from them. We're grateful for your willingness to serve on this council. And as Jason said in introducing and opening us up today, the suggestions you all make really make a difference for us. It gives us the opportunity to go back and look at our processes, look at some challenges that we have in the system. You know, we know that we have a lot of things that we can improve. We also know that we've made a lot of improvements through many of the suggestions that were made right here, by this council and previous council members, and you all are doing a great job of providing input. So we're just really thankful. We have a lot of connectivity right now that's happening during what I'm going to call the off season of legislative session. We have a review process that's going to take place over the course of about the next year. And we have some partners in the legislature who are eager to take some suggestions from us and from this group probably too on what more can we do? How can we improve the connectivity between programs, the continuity of services? And, as I said, our team is excited to serve and to find new and better ways to serve. And so you are the reason why we are here, and we're just thankful. And again, thank you for being here today, and have a great meeting. Look forward to hearing about it. Thank you so much.
All right, thank you, Secretary Putnam. I heard some talk in the room about our next meeting, and why don't I get that out of the way? July, the first Tuesday, is it maybe the second Tuesday in July? It's either the 9th or the 10th, I think. I'd have to look at my calendar, but it's a week earlier than we would normally meet, and we're going to meet in person this July as opposed to online because it's the first meeting of both our council and the newly formed Medicaid Advisory Committee. So because some of you will serve on both of those and because it's the first kickoff for that committee, we're going to meet in person. Normally our summer meeting is virtual because there's a lot of people out and out of the office on vacation, but we're going to do it in person. So, and then we're going from 3 meetings every 6 months to 2. And so our next meeting after that will probably be October. So we'll be going from 6 meetings a year to 4. So, but we've talked about those changes. Also, I want to welcome some of our members who are watching online. You've got my cell phone. So if you have questions or comments during the presentations this morning, you can text me and I'll include those questions or comments. If you want to get a feel for being here, even though you're not here, turn your thermostat down to about 65 and you'll feel like you're here. Although it is warming up now. It'll get warmer as we go. So our first presentation of today, let me first allow our chairperson and our co-chairperson to offer some welcomes as well, Brandy Vaughter and Jennifer Yeager.
Good morning. Just wanted to thank everyone who was able to be here in person, and just wanted to encourage our council members to, talk to talk to your friends, talk to other recipients of these benefits, and share their stories and share that information, especially with Jennifer and I, so that we can kind of convey that to the leadership and to have more opportunities to make changes in the future.
I was just going to say, I'm glad that all of you are here today and that we're getting to meet some new faces.
All right. Thank you, ladies. So if you look at your agenda, you'll see that legislative recap is the first thing on the agenda. The recently concluded session of the Arkansas Legislature included many proposals that became law that impact DHS and the populations we serve. So several division leaders are here this morning to just talk about some of these changes. We have Paula Stone here, Assistant Director of the Division of Behavioral Health Services. We have Elizabeth Pittman, Division of Medical Services Director, and we have Mary Franklin, who is the Division of County Operations Director. So I have Paula as kicking things off. If we want to go with that, that's great. Paula can come on up. She's going to talk a little bit about bills that impact the passes, as well as, I believe, the rate. Are you going to discuss the rate review quality bill? Okay, great. So Paula Stone, thanks.
Hey, good morning. Nice to see you all again. Just to clarify, I think I'm the director of the Office of Substance Abuse and Mental Health. And so we have that as an office instead of a division because years ago we combined the Division of Aging and Adult Services and the Division of Behavioral Health Services. And we pulled behavioral health out because we believe that both the aging population, which we have population growing with aging, needs a full focus, and behavioral health needs a full focus. So in the Office of Substance, and we thought during the session that there might be a chance to make it two different divisions. We called it that we were going to get a divorce. And we were going to have two different divisions, and that did not happen during this session. And so we are, Jay and I call it an amicable separation, right? Is that we're, and we may get a divorce someday, but right now we're just separated. But it's very amicable. And then under the Office of Substance Abuse and Mental Health is all the mental health services, obviously all the substance abuse services. The state hospital is under the Office of Substance Abuse and Mental Health, as well as the provider-led Arkansas Shared Savings Entity, even though the passes cover both the DD population and the behavioral health population that's living under OSAM, and we run that. But we do that hand in hand with Jennifer Brzee at the Division of Developmental Disabilities. Anyway, I'm sure that's just much more complicated than anybody ever wanted to hear, but there you go. You'll remember that amicable separation part, I'm sure. So, as part of lots of activities went on during the legislative session related to substance abuse and mental health and forensics, and I think we have some of that later. But let's talk a little bit about the PASS. So the PASS is the Provider-Led Arkansas Shared Savings Entity, which is the program that we developed back in 2018. And it is a managed care program. And we put two populations in that managed care program. And it's managed care in the sense that we have a managed care company that comes in. We have 4 passes. But it is a partnership. It's a little different. It's provider owned and led. So it has to be 51% owned by Arkansas providers. So typically with a managed care company, you have this external company. There are humongous companies that come into states, and that money goes out to wherever that managed care company originates. We really wanted to make sure that there was investment here in Arkansas. And so that's how we do the provider-led Arkansas Shared Savings Entity. The PASSes. It's an unfortunate acronym. We've been saying that since 2018. The person who developed the acronym will no longer be able to do acronyms. We don't trust him to do that anymore because when you put it, it's PASSE, and when you put it in like an IM, or if I text it, it autocorrects to passe, which is a very negative thing. So anyway, and you have to force it into that. So. But that's the acronym PASS. Has 2 populations in it, people with mental health conditions, children and adults would have significant mental health conditions that cause some sort of functional deficit with their ability to live in home and community settings, and people with intellectual and developmental disabilities that have the same functional deficit. So as I said, we've been running that since 2018. We started with 3 passes. We now have 4. So through the years, changes have been made. And one of the things that associated with this is when we originally started this, there is some services that the people with intellectual disabilities and the people with mental health conditions receive. They're called home and community-based services. They're delivered by paraprofessionals, and there are very specific Medicaid rules for home and community-based services. And since only the PASS members were getting those home and community-based services, then we said, the PASSes can set the rates for those. We call it PASS-only services because Medicaid, our general Medicaid, is no longer paying for those services. Only the PASSes are paying for that service. And so there have been lots of questions about that. Did we do the right thing with that? We're always open to say maybe there's another way to approach this. And so during this session, we determined that there was another way to approach this, that we would set rates for PASS services, because one of the things that happened is some of those rates for those PASS-only services we had set back in 2015, and they really hadn't changed. And each of the 4 passes could kind of make their decision on whether those rates would change. And they really had struggled with that. We want both the services to change, and that we're trying to make some changes in those services to make them be delivered in a different way, but also the rates. So during this session, there was a determination that we would set rates, and there would be a rate-setting activity for those services. And we've already begun that. So we have a company called Milliman who also sets the rates for the passes, and they've come in. Jennifer and I, wearing my hat of OSAM, of the mental health piece of this, chose 8 providers. Jennifer chose 8 providers as the technical group, and those providers are coming to the table, and there's going to be a what is called a cost buildup. So there's lots of different ways to set rates in the Medicaid world. One of the ways we set rates in the Medicaid world is doing state-by-state comparison, saying, okay, what are other states paying? A lot of the rates that Elizabeth set, we use Medicare as a standard. And so we may do a percentage of the Medicare rate. In this situation, we said, we really don't, home and community-based services are very specific to each state. They look different. On the DD side, we have a service called supported living. Is it TIV, supportive living, or is it supported? I get mixed up, y'all. And so what I've been doing all along is I just kind of slur my last, supported living. So I try not to do that when I'm speaking publicly, but just in meetings, I just slur the end of it because I never can remember if it's supported or supportive. So that's a service. That's one of the bigger services that are being provided for the DD population. On the mental health side, we have a service called behavioral assistance that's delivered a lot for children. It's only a children's service, and it's being delivered in primarily in schools. On the adult side, we have a residential service called therapeutic communities, where adults with mental health conditions can go and live for short term, stabilize. There's 16 beds or less, so we have that service. So we are going in and working with those 16 providers to provide technical assistance, and we're really looking at using part of the what we're doing to set those rates is using costs. The service is not 100% cost-based, but we're looking at who's providing the service, how much does that person, what is their salary, if there's travel involved with the service. Are we requiring 24/7 coverage with the service? Is it weekend? Is it rural? Is it urban? All of those things are going in, and we will be setting rates for those services. And then once those rates are set, we'll be going back through. We'll be updating some manuals because I think with setting rates for some of those services, we'll also need the manuals updated to have a better definition of those services as well. And then we'll be going through legislative review. We will be entering those rates, and then the passes will be paying at those new rates January 1. So that was the big issue with the passes. The other thing that we did during this session is to get into the PASS program and to get these home and community-based services, you have to have an independent assessment. That's a Medicaid rule, a Centers for Medicare and Medicaid Services rule. And so with the behavioral health population, you have to get that reassessment every year, annual. It's a requirement for annual reassessment. For the DD population, you have to get that reassessment every 3 years. And so we determined that the assessment that we're using on the front end and the assessment we're using for reassessment are the same. They take about an hour. And in speaking with the providers and the passes, we determined that that's just a little too long for people that have already been in the pass, and they just need to be re-upped. And we can use other mechanisms, and we can decrease that time of that independent assessment to be a little more doable, because those are interviews with parents and with individuals. So that's the other thing we're going to do, is to make sure that we get those reassessments, that they're accurate, but they're done a little quicker. I think those are the only two things I'm going to cover on the pass. Are there any questions before I hand it to the next person?
Any questions? We did have one from members watching online. As part of the rate setting, does that include setting individual rates for services for waitlist members, such as personal care, also as well as who can provide personal care?
So personal care is a what we call a state plan service. It's not a home and community-based service. So we have so personal care is different, and that falls under J. So if you want to answer any questions about personal care rates or anything, or have Elizabeth answer that, we are setting rates for home and community-based services. So those are the services that are either in the DD, the CES waiver, or the behavioral health one.
And again, as well as who can provide personal care, did the legislation have anything to do with that?
No,
Okay.
There's no changes there.
Okay. All right. Oh, Shannon has a question.
Does that have anything to do with rate setting in the waiver?
Or let's say that again, because the folks online can't hear unless we have the microphone.
Is that relevant to the AR choices waiver?
So this is only the waivers associated with the DD and the behavioral health, and AR choices is for the aging population. But Jay, do you want to add something there? Or
I do. I was just going to touch on the rate setting. Jay can answer any questions about the services themselves, like who can provide personal care. I'm not going to touch on that. But I will let you know we are undergoing our rate review cycle now for our state plan and other waiver services not covered by PASS. So it doesn't include PASS. Paula covered that. Anything else, we use a 3-year cycle review, and we can go over that at a different meeting, or I can get you a link to the schedule. Personal care and AR choices, we are starting that now. A survey, I think, has gone out to the providers. Is that right, Jay?
Yes, they've been returned.
And they've been returned. I believe the draft is now sitting with me for review. So hopefully we'll get. So we have a draft of a report. So what happens is we review that report, put it back out to the providers, give them a couple of weeks to comment on it. That report is just step 1 of about a 4 or 5 step process. If that report determines that we need to do further analysis, then we send it to a group like Milliman, who sets rates, to do more in-depth analysis on what a new rate should be. So that's where we are in that. We are looking at personal care and AR choices now. Just wanted to let you know that. And Jay, if you want to add anything about the services themselves.
Okay. Other than the questions that Amy Cobb asked online about, what were they? Eyeballs. Include individual rates for services or waitlist members, such as personal care.
So there is no wait list for personal care. Personal care is a state plan service, and presently AR Choices also does not have a wait list. While our waivers do require both an annual cap and a point-in-time cap on beneficiaries, we're not near either one of those. And so for persons that apply and that are determined eligible, they are able to receive those services right now without a wait list.
And were there any changes for who can provide personal care that came out of the legislature?
Department of Health is responsible for licensure of personal care agencies, and I believe they took over, look at Martina, shake her head, they took over the certification piece for personal care aides. The only really change to personal care services as far as who can provide, our PACE providers, which is the Program for All-Inclusive Care for the Elderly, were granted a waiver from receiving a personal care license because they are a hospital-based program and they are able to also provide personal care in the home, in a home and community-based service setting. That was really the only change. It was more or less a cleanup of their licensure status, but it didn't affect anybody's ability to provide personal care.
All right, thank you, Jay. Also at the Capitol, we made a lot of improvements towards helping the maternal health outlook here in Arkansas. DMS Director Elizabeth Pittman's going to touch on that. She may also touch on the changes for Medicaid patients in the way of dental care. A few things. Okay. Do you like stick mic or?
I'll use that.
Okay. All right.
All right. So we were tracking, as a Medicaid agency, several hundred bills. And of the ones we were tracking, I will tell you that over 100 went to the governor to be signed. I am not going to talk to you today about 100 bills because we'd be here all day. Also, they're not all that exciting or really change all that much. Some of them just sort of put into law what we already do. So I'm not going to touch on a lot of those. I am going to touch on some things I think you might find relevant. And if you have any questions about anything that passed, feel free to reach out to me and let me know if there's something I don't touch on today that you have a question about. So as Jason said, one of the two biggest things that were the focus this session is maternal health care and dental care for Medicaid clients. I think we touched on last time I was here the Healthy Moms, Healthy Babies Act, which was signed by the governor. There was both a Senate bill and a House bill, so there's two act numbers. They're identical. And they do several different things. The first one is they create presumptive eligibility, which I'll actually let Mary tell you more about that if you have questions. But the basic gist of it is that when you come in to apply for Medicaid as a pregnant woman, if you can't immediately get approved and we have to do what's called pend your application, we can give you something called presumptive eligibility, which allows you to go on ahead and go to the doctor and start getting your prenatal care, your lab services, your prenatal vitamins, all that good stuff. So you're not waiting to access that care while your Medicaid application is pending. And that was something that the providers wanted us to do because a lot of providers of OB care don't really want to risk that a woman's going to complete that application and that it's going to be approved before they start providing those services. Another really exciting thing it did is it unbundled what we call our global obstetricians rates. And what that means is we used to pay OBs for prenatal care, labor and delivery, and postpartum care all with one pretty low rate. It had not been changed in probably 20 years, so it was very low, definitely the lowest payer in the state. And it included all of those services. So it didn't incentivize getting a woman in earlier for prenatal care, and it really didn't incentivize getting her in for her postpartum visits either. So it also made it really hard to track how many prenatal visits a woman had. We didn't know. If she went 2 months before or 4 months before, we didn't know because our system paid it all the same. So we had to do a lot of searching. We had to do connections with vital records and use the self-reported data from a woman on the birth certificate about when she first saw prenatal care. So we're hoping that by unbundling, paying for each prenatal visit separately, the labor and delivery separately, and then the postpartum, we'll get better data on how much care a woman's receiving during that pregnancy, and will incentivize more visits because you're paid for each one. It also created the requirement that we pay for doulas and community health workers for maternal health. And I'll tell you a little bit more about those because there are separate acts for those that we'll go into. It also required that we cover remote monitoring. So Medicaid already covered glucose monitors for women, so CGMs. We also already covered blood pressure cuffs for pregnant women if they had high blood pressure. But what we didn't do as part of that is the monitoring piece of that. So like remote ultrasounds, remote fetal heart rate monitoring, remote monitoring of CGM. Did I do that? Okay. It's like, oh dear, I'm knocking things over. Anyway, so now we're going to cover all of that remote monitoring as well. We're going to try to. We're going to figure it out. It's our first foray into this. A few other things that were covered, lactation consultants are now covered under a separate act, so we will now be covering lactation services for women. It also requires that we cover deliveries in a birthing center, which we're excited about, but I will say there are no birthing centers in Arkansas right now. So we got to get some before we can pay for them, but we're working on it. And then there was also, again, separate acts around doulas and community health workers. So doulas are birthing assistants. They are not clinicians in that they don't provide medical services, but they advocate for a woman during her prenatal period, during the delivery, and during postpartum. So they help a woman create a birthing plan, navigate the healthcare system, get ready for pregnancy. They teach her what's going on with pregnancy, what to expect, what's normal, what's not normal, so that the woman can be on the lookout herself for signs of complications or risk. And because they're different than what you and I would experience as risk non-pregnant. As if you've been pregnant, you probably know a lower blood pressure or heart rate could indicate a problem than what is normal. If we go in with a blood pressure of 140 or a heart rate of 140, no one's going to say much. But if a pregnant woman does, that could be a real problem. And so they teach you things like that, right? And that you need to look for these warning signs. So there's now a certification requirement for doulas. We're working with UAMS and the health department who will be certifying them to get that certification in place. And then there's also one for community health workers who, again, are community health education specialists. They teach you how to navigate the health system. They help you access services. They teach you about good nutrition, physical activity, things to look for as warning signs, and chronic disease management. So the Act actually requires that we cover community health workers in more than just the maternal space. We're going to start with maternal and then kind of expand outwards. So just so you know, our timeline for these is aggressive as always. We are targeting July 1st to turn on presumptive eligibility and the increase to the rates and unbundling of the rates. And then we plan on coming in on October 1st and covering all of the other services, the doulas, the CHWs, the remote monitoring, the lactation consultants. We're also looking at e-consults as part of that as well, although that wasn't an act. And we found that OBs in rural areas or non-urban areas need that e-consult access to a high-risk obstetrician here in Little Rock or in Fayetteville. And so we're looking at how to provide that through an e-consult. All of that, again, is being targeted for October 1st. We are, however, working with the health department to make sure that the new certifications are turned on before we start trying to enroll and pay for provider types that aren't certified. So a lot of that 10-1 timeline is dependent on their rules getting through their process as well. So fingers crossed we make it. We're really excited about all of this. It's very much needed. But it is an aggressive timeline for all of us. So keep on the lookout for it. So there was also a big emphasis on dental care. But before I move on to that, do you have any questions on any of the maternal pieces? That was a lot. Okay. So dental care. There were 3 main bills involving dental care. One was a rate increase. It's a pretty significant rate increase. Again, dental rates had not been increased in about 20 years. Honestly, they hadn't been needed for quite a while. We had a requirement to pay them at a pretty high commercial rate back in 2007. 2005, something like that. And that really kept us ahead of most other states for a long time. And about 2 years ago, we kind of lost that parity with other states, and so then we needed a rate increase. So they're getting another significant rate increase out of this bill. It is, again, asking us to look at commercial rates and other payers. There's a national publication put out that we've been asked to use to set this rate, and so we're working on that right now. It also increases the limit for adults with special needs. So I think we've talked about this before, but our dental limit for adults is $500. It is a hard limit, meaning we don't really have the ability to increase it after you hit that $500 cap. For children, it's unlimited. We provide any dental benefits needed for a child, but for adults, it is a pretty hard cap of $500. Because a lot of special needs populations need sedation dentistry, that $500 doesn't usually get very far. So there is an increase to $1,000 for that population. And that's for everyone that qualifies for that population. The bill does not define that population, so that's great. So we are trying to define that, and we are using the definition that we typically apply to our developmental disabilities population. So what we're doing is if you qualify for the waiver or wait list, or you're in an HDC, so you're in a PASS because you have an independent assessment for developmental disability, or you're residing in an HDC, then you would be qualified as a special needs and you would get this $1,000 increase. So that's how we're doing that. The other thing they did for special needs population is they created a bill that creates a new provider type called an academic medical center. What that is something like the new dental school or UAMS, where you have a teaching institution that provides dental services in a clinic setting. And we will now pay them for sedation dentistry, anesthesia, and the dental care provided. That actually, each instance can be up to $30,750 with an annual cap of $5,000. So that is actually very needed. Children's Hospital has limited who they cover in recent years, really limiting their population to children as they are a children's hospital, and that's left a really big hole for our adults with special needs. And so we're hoping by creating this new provider type and this new service that we will be able to do that. Companion bill to that is those sedation dentistry services will now be part of the PASS package. One of the other things we've run into trying to get this done is the medical piece of that, the anesthesia, the hospital was covered by the PASS, but the dental services were not. And so providers were trying to figure out how to, we've asked UAMS to come in and help us, but this has been a huge problem that we're still trying to overcome because UAMS is trying to figure out how to bill the passes for part of it and how to bill us for another part. And there's not currently a provider type that really does this. So how do we do this? So we're hoping that this will clarify that and put it all under the pass and make that a much smoother process for everyone. So I'll be working with Paula on that. So more to come on how we're going to do that. Some other things, I don't want it to take too long, but they're renewed the Our Home legislation. So Our Home will continue for another 5 years. The way it's delivered will be the same. It's still being delivered through the qualified health plans. So it's still Ambetter and Blue Cross Blue Shield, as long as they continue to sign agreements with us. We will still be offering Life 360 services, and it does allow us to expand Life 360 services beyond just hospitals. So FQHCs and other provider types will now be included. So we're excited to see if that grows, the Life 360 program. The other pieces are mostly financial, and I won't bore you with the details, but the idea is to get more state general revenue and back to the state and use less to pay for the program. So we're changing some things. One thing that I think is pretty important is the minimum loss ratio. What that is the percentage that has to be spent on services. So federally, it has to be 80% of the money that they receive has to be spent on services. That's what we've been holding them to all these years. We're increasing it to 85 for the Medicaid population. So more money will now have to be spent on services. And if they don't do that, then they give it back to us. So we'll get more money back for them not doing services. So either way is a win-win. Either they provide more services to their clients and they don't give us any more money, or they don't and they do give us back more money. So we're excited to hopefully see the first, not the second, but and then there's some other things there that just make them pay higher rebates back to us or more. I won't get into all the technical details because it took me 2 years to understand the financial process. But if you have any questions about that, just reach out. Some other things that we now get to do, physician's assistants will now be considered PCPs. Physical therapy services can now be provided in a clinic for adults. That has been a problem for rehabilitation therapy for children and adults after an accident, not for like your rehabilitation therapy because of a developmental delay. But if you get in an accident or you injure yourself, have surgery, and you need physical therapy, you can now go to a clinic. Previously, you had to go to a hospital or a outpatient facility. So now you can go to the PT clinics. Mobile units will be required to be covered. We're going to be drafting a traumatic brain injury waiver. Let's see. We will be on a work group for primary care to increase the spend for primary care in the state of Arkansas as a percentage of overall health care spend. So that's exciting. There was an increase to lab services for people with chronic pain. I think the reasoning there was because of the increased drug testing required for that population. They wanted to increase the lab services for them. I think that's it. There were a lot more bills, but I think that's all I planned to cover today. So, as you can tell, they kept us busy. Any questions about any of that? It was a lot.
Would you cover 20, 25 of them?
Yeah, about a quarter.
Yeah. Shannon has a question. Hold on, wait.
I noticed in the agenda it talked about the ABLE program and raising the limit on that. I didn't know if you were going to cover it now or
I think Mary's going
later.
to cover the ABLE program.
Okay. Just make sure I didn't miss it.
Nope, you did not. I'll let her do it then.
All right. Yeah, so you heard Elizabeth touch on the authorization or the reauthorization for the Our Home program. Part of that was the legislators wanted us to come up with a work requirement for the Medicaid population for certain people who receive benefits. And Pathway to Prosperity was already in the works. So she can update us as to where we are as far as Pathway to Prosperity is. Thanks, Mary.
Good morning, everyone. I will touch a little bit more on Our Home that Elizabeth talked about, but included in Act 774, which reauthorized Our Home for 5 more years, there was a requirement that we apply for a waiver to include work requirements as a condition of continued coverage in Our Home. And so we have actually submitted a waiver. I think we talked to you about it previously, and we call it Pathways to Prosperity. That does include that community engagement work requirement. And that is through the public comment period and through the federal public comment period. So we will continue to work through the details of that. And I will also mention there is, at the federal level, discussion, talk of including a work requirement in Medicaid as well. So we will watch and see how that turns out, and we will adjust accordingly, to make sure that whatever we request to put in place is in compliance with federal rules as well. So for the Division of County Operations, let me talk about the change to the ABLE account. ABLE, Achieving a Better Life Experience program. That program had a change at the federal level, which changed the age, increased the age for the onset of disability in order to be able to qualify for starting an ABLE account. And an ABLE account allows someone who qualifies to set aside money that can be used for things that they may need, equipment that they may need, save for retirement. I mean, there's a wide range of things you can use an ABLE account for. And we exclude the ABLE account from the eligibility determination process in Medicaid. And at the federal level, the age increased from 26 to 46. So if you become disabled at any point up to the age of 46, you would be allowed to start an ABLE account. And currently it's 26. So it's a pretty big increase in age, and we are excited to see that. And then the state legislature followed, and an act was passed. It's Act 875, if you want to look at it, that in Arkansas allows an ABLE account to be created up if your disability happens up to age 46. So and this won't just involve the Division of County Operations, the state treasurer, AR Rehab Services, but for our part in the Division of County Operations, we will update our eligibility policy to make it clear that you would qualify for an ABLE account if your disability occurs up to age 46. So we will be working on promulgating that rule change and get it enacted over the next few months. Elizabeth already talked to you about the maternal health changes, so I won't go into that. I will here. This one also impacts healthcare, though, and what it does, I think it'll have more impact on the eligibility process. There was already the Arkansas Healthcare Decisions Act, but this act, which is Act 202, allows a surrogate, and in this context, surrogate basically means representative. If you're acting as a representative for someone, helping them to apply for Medicaid, it authorizes banks and give you better access to bank and financial records, because that has been something that has been difficult for representatives to obtain, even with the client's consent. So that act was passed. And moving on to the Transitional Employment Assistance Program, and that is our state's program. It's part of TANF, the Temporary Assistance for Needy Families Block Grant, and that program is designed to help families become more self-sufficient. And if you qualify for that program, then you work with a case manager, you develop an employment plan, and you follow the steps in that employment plan to help you increase your income and hopefully not need cash assistance any longer. In the previous legislative session in 2023, there was a law that was passed that limits that cash assistance to 12 months. Act 640 that was passed this session in 2025 does require us to add and require applicants to engage in job search activities while their application is being processed. So we'll be promulgating a rule to add that requirement where it's appropriate for individuals who are applicants in the Transitional Employment Assistance Program. These other two have a food impact. This one is not necessarily a SNAP impact, but there was an act passed. It was Act 870. And it created the Arkansas Healthy Food Retail Act, which provides financial incentives for healthy food retailers in underserved area. And we'll talk about it more this afternoon. This one actually does impact SNAP. This one requires us to submit a waiver, which we have actually already done, that will change the eligible foods list for foods that are eligible to be purchased with SNAP benefits. And we have some time set aside after lunch to talk more about that SNAP foods waiver. The other act that's related to foods, there was an act passed that helps to incentivize an increase in SNAP retailers in underserved areas, and this one is not being administered by DHS, but it was an act that was designed to, if there's funding available, to provide grants to stores or agencies that want to become SNAP retailers in underserved areas. So and those are the main ones. Secretary Putnam, I think she mentioned this morning that there were a couple of acts passed that have to do with studies for DHS, things we can do to become more efficient and provide better services. So we'll be participating in those. And with that, happy to take any questions about these.
Legislation Mary discussed, or maybe there was some legislation that you're aware of that we haven't touched on that you wanted to ask a question about. We have people in the room that could probably help answer your questions about that. Shanda, did you want to say anything about the act regarding the ABLE accounts that was passed? Not really. If you guys remember, Fran Jansen came and made a presentation on those ABLE accounts, and one of the biggest changes she wanted was to raise the age, which is what happened this session.
Just to get technical, it's always been my understanding that you have to have an onset of disability prior to the age of 26. So is it prior to the age of 46 or 46 and below?
So right now it's 26. When we get this law said that we can match the federal change, which goes up now to 46, I think, starting next year. Okay. So we'll be promulgating the change here in the state to increase the age. I mean, along with the state treasurer, because at DHS we don't manage the ABLE accounts, but we manage we'll execute the piece where it affects Medicaid eligibility to make sure that our rules match this change for the onset age of disability to be increased to 46.
Okay, thank you.
You're welcome.
So at 55, I'll still be out of luck, but anyone 46 and under would be okay. All right. Well, that is our legislative recap for you. Appreciate your attention. Thank you to our presenters for boiling down 3 months of activity in 30 minutes or an hour. So we appreciate that. We're about at time for lunch. We're a few minutes early, so we're going to break for lunch. And when we come back, we're going to learn about the condensed DHS application for benefits. Mary will rejoin us and present on that. So I got a couple of pieces of news for you guys concerning our next meeting. We're going to have 3 of you serve on both councils. If you live more than 75 miles away, you will be eligible to be able to stay in town. We'll pay for one night's lodging, either the morning before both meetings or the evening after both meetings, because it would be too long a day to ask you to drive 2 hours, spend all day in meetings, and drive 2 hours home. So if you can swing it, and if you're interested, and if you live more than that distance away, lodging will be possible. Also, if you do attend both meetings, you will get 2 stipends. It's 1 stipend per meeting. So that's good news as well. So I know that our chair and vice chair have the opportunity, should they want to attend both meetings. Do you guys already know if you'll be available on July 8th to attend both meetings? Okay. So then we just need to decide who our 3rd member will be. So think about that. At the end of this meeting, we'll decide. If you're interested and you look at your calendar and you know that you have availability on July 8th to attend both meetings and you're interested in doing that, then you can nominate yourself. That rotating, floating member will rotate each time. So if you serve at the July 8th meeting, you may not ever serve again at both meetings. It just depends on who's interested and what the availability is. If a lot of members are interested in attending both meetings, we'll just rotate and give everyone the opportunity who wants to do that. All right, so Mary Franklin is still here, and she is going to talk about something that you guys have been very interested in from the start of the Medicaid Client Voice Council. From the start, I have heard too much duplication of paperwork, too complicated paperwork. So the Division of County Operations has taken those comments seriously, and they've been working hard to condense the application and make it uniform so it can apply to across programs. So let me welcome Mary up. She's going to explain to you, get some feedback on this new application. She's going to show it to you, give you a first look. So come on up, Mary, and kick off our second half of the meeting.
Well, hello again, everybody. I am excited today to introduce you to Brianna Strassner. She is not new to the Division of County Operations, but she is new in our management team in our policy unit. She's the deputy of our program and grant management unit, so she supervises the staff that write the Medicaid eligibility policy, the SNAP policy, the T policy. Her team is involved with our ARIES team when we make changes to the system that involve changing the rules and how it works. Her team is a huge part of that. They interact with our federal partners. We do a lot of meetings with the feds, and we ask questions and get clarifications. So I am excited to introduce you all to Brianna Strassner. She's another one of our subject matter experts. She has spent 15 years with DHS. So I said she's new, but not new. And she's been a caseworker, a program eligibility coordinator. She has been a county administrator in one of our county offices. So we are excited. And she's actually going to stay in the county office. She's not going to drive to Little Rock every day. But with our technology now and our virtual meeting capability, we are doing things a little bit differently to make sure we get the most qualified people in these positions to help us. So Brianna actually led the team that worked on the new paper application, so she is going to help me do this.
And I will say we worked really hard on this application and did a lot of work and worked with our team and our contractors, and I'm very proud of it. So I hope you guys like it.
We are proud of it.
We worked really hard.
And I do think it's better. I definitely do, but I'm excited to show it to you all. First, I'm going to show you, we're just going to talk about, have a little short PowerPoint. And then I'll show you the old and the new so you can see them side by side. All right. So we did work with our contractor that has a human-centered design team that researched a lot of states and looked at applications and looked at what's working and not working. But our goals in redesigning, we wanted to redesign our application, and we also wanted to get presumptive eligibility for pregnant women out, off the ground and implemented as quickly as possible. So we rapidly, folded this in so that we can do both at the same time. We wanted to redesign to make it more easy to use, streamlined, shorter, easier to fill out. But we had this process, and we also wanted to look at any business process changes or system changes we might need to make to get this done, and of course, get the necessary approvals that we need. And I will tell you, this team involved Brianna and policy folks that are from our field operations that actually do the casework, and as well as our contractor and our representative from our communications team. She's usually here at these meetings. Amber Elamine served on this committee too, from the perspective of making sure it was readable and user-friendly from someone who's not right in the middle of it. Sometimes those of us who do it every day and determine eligibility, and we're so in the weeds in our language and what we know, it's hard to take that step back and think about how things look, from someone else's perspective. We were going for simplicity and clarity, a logic, plainer language, larger fonts, concise instructions, visual cues that help guide you visually, and then progress indicators to tell you about where you're at and how much more you have to go, and putting it in a more logical order with section breaks and grouping program-specific questions together, address overlaps and discrepancies. As part of this, not only did we look at the paper application, but looked at the citizen portal and then our worker portal too, with the idea to make it all flow naturally, and to minimize the burden of the person filling out the application. We consolidated questions to remove, like I said, the duplicates, prioritize questions that we really need to have the answers to that are eligibility factors, and took out some, particularly for SNAP, because this is an integrated application. Remember, you can apply for all of our Medicaid SNAP-T services at DHS on this integrated application. And we also revised it to make it OCR compatible, and what that means is machine readable, because we would like to do an enhancement at some point so that if we do get that paper application, when it's scanned in, the machine could actually read it and fill in the blanks, so we don't have to wait for a person to pull that paper application up in the system, look at it electronically and see what it says in this blank, type it over here in the system, because that technology has improved over the last several years. And we're not there yet, but we designed this with that in mind, that we would like one of our next steps for efficiency and additional automation to have this application readable by the machine to save us time. So I'm going to show you the whole application. This is just a sneak peek of one of the pages, and you can see what we mean up here by section breaks. You see the program-specific details. Here, visual cues. These are symbols. This page is for SNAP and T. So that's what this means. Larger fonts, easier to read, easier to fill out. And then this minimal design. There's not a lot of frills here. It's just trying to get what we need in as easy for the person filling it out as possible. At the bottom is a progress indicator. And if you're on this page, then you're at the SNAP and T section. You can see where you have to go. And then again, these boxes and the circles, that's that OCR compatibility to make it machine readable when we make that technology This,
need to move up closer to see it better? Feel free if you do.
this box here in the back, can you see my mouse moving over it? This is how many sections are in the current application. And there's a legend over here. The purple means that these questions apply to all the programs. The blue means it's not an eligibility factor. It doesn't have to do with eligibility. The orange is SNAP only. The kind of green is healthcare only, and the other green is T only. But I think what I want to point out to you here is you can see pink kind of all over everywhere. It's not grouped together. It's a lot of different places. In the new application, there's only 3 sections, and the legend still applies. This purple is for all programs. The orange is SNAP only, and the green is T, and then that aqua is healthcare. So we have fewer sections. We've grouped questions together that make more sense to be together rather than just having it spread all throughout the application. And this kind of takes it down to nuts and bolts. In the current form, we have 17 pages. We're now down, and then there's 13 pages in the appendix for the current form. The new form is 13 pages with 11 in the appendix. And I know that the page reduction isn't as much as we had hoped, but part of the reason for that is the bigger print and the way that it is laid out. So we didn't get a lot of reduction in the number of pages, but you can see the sections, like we went from 23 to 3. In the questions, we went from 309 to about 194. So about 80 fewer questions to fill out. Right. So that just sets you up to see the new application.
And there are no duplicates.
No duplicate questions. So this is our old application. This is the new application. I guess this is not ideal. Here on the left, the old application, page 1, and the new application, page 1. You can see our on page 1, one of the things I want to point out here, you can apply for SNAP, T, healthcare, any one of the 3 or all 3. And in healthcare, right below it, we have the bubble that says, and if you need to apply for programs to help and cover the home and community-based waiver services, in-home care, Medicare premiums, nursing facility, autism, TEFRA, mark this box. And then on page 10, you're going to see something like what's here on page 1. And then here at the bottom are additional instructions. You know, tell us if someone's helping you fill out the application, if you have a household member who's a non-citizen, a child who has a non-custodial absent parent. And we're asking these questions because we're going to direct you to part of the appendix that you will also need to fill out, okay? And then you see at the bottom here is our tracker, basically to tell you where you're at. Right now on page 1, it's the basics. Page 2 of the old application. Page 2 of the new application. This is give us the basic information of the person who's applying. Address, city, state, phone number, and the language preferences here, and whether or not an interpreter is needed. This is our About You page. Page 3 in the old application is for SNAP expedited screening, and that, based on SNAP rules, has to be close to the front of the application, so it's still close to the front. It's page 3 of our new application. But bigger font and fewer things to fill out. We're still in the About You section here. This is page 3. This is where you start telling us about household members, and you see all these questions, and then there's 2 columns. You can tell us about household member 1 and 2 here. But page 3 or page 4 of the new application, this is what the household member section looks like now. You'll put the name, you mark citizen, give us the social, and then mark if they're requesting benefits for SNAP-T healthcare, because not everybody in the home needs the services, and not all the time are you applying for everyone to receive services. So this is the page where you can tell us that. It's a lot less congested, and you can see our symbols up here. We're telling you we need this for all the programs. So whatever you're trying to apply for, we need this page. And this is the household section, see at the bottom. Page 5 is more questions about the household members. And we're asking more questions here. But one of the things you'll notice is we ask a lot more specific questions in the current application. And this one, we're giving you more blanks to tell us what you have rather than asking all the individual questions, because some of these things are more rare and not typical for everybody to have them. So we took that into account when we were developing this new application. This is about the household finances, the assets and resources. And this is additional household members beyond the first 2 here on our current application. So it's repeated pages basically, but we're doing that in a more consolidated way in the new application by giving you space to enter the information for multiple people on the same page. This is a household finance and income section. You can see person 1, person 2, person 3, and this is for all programs, and you've made it to about the middle because you're giving us the answers to the financial questions here on the new. This is about household expenses in our new application, and you can see this one's needed for healthcare and SNAP. Program-specific details here. This is for SNAP and T cash assistance. So if you're not applying for these, you can skip this page, and we're trying to make this more clear. Here in the old application, we're talking about tax information here, and that's really only needed for health care, but it's not clear on this old application that it's only needed for health care. And I'm going to catch up. Here in the old application, we start to ask about income, additional income, and then we're to non-custodial parent information in the old application. And in the new, here we are in the healthcare section. The first page where you would mark, yes, I also want to apply for a specialty program, and it said go to page 10. Well, this is page 10 where you can mark if you need AR choices, or you want us to evaluate you for AR choices, assisted living, the autism waiver, the community employment support waiver, which is the DDS waiver. If you need a spin down, a medically needy spin down, or the Medicare savings program, or nursing facility, PACE, or TEFRA. So this page, it's in bigger font, and you can see what to mark. This is also just for healthcare. So if you're not applying for healthcare, you can skip this section. This is additional household details for healthcare, tax information for the healthcare program, and then review and sign. And we added a notes page because just in case we didn't give you enough space somewhere else, or there's something you want to communicate to us, you can write it on this notes page that we're going to scan and update, or if you had different types of income and there weren't enough boxes, then you can add that here. So This page you don't have to fill out if you don't need to, but it's there if you want to give us some information that you think will be helpful for us to process your application. And then this is Appendix 1 for authorized representatives. I'll tell you what, I think have you seen enough side by side to see the differences? Then I'm going to just close the old one and make this one bigger. And you can tell us if your authorized representative is representing you for SNAP, T, healthcare, or all three. And then you'll sign here, and we're on page 15. This is Appendix 2 about details if there's a non-U.S. citizen. And again, you don't fill it out. If it doesn't apply to you, you don't fill it out. This is details about a non-custodial or absent parent. If it doesn't apply to you, you don't fill it out. This is also for a minor not living in the home. If you have a minor child but it doesn't live with you in the home, this is information that we need. But if it doesn't apply to you, you skip it. If you are American Indian or Alaskan Native, that's information that we need to know. But if it's not applicable, then you don't fill it out. This is applicable to the TANF program only, to our transitional employment assistance only, because we are required to do a drug assessment, a drug screening. So if you're applying for T, then we need you to answer these questions. Fill this page out. And then we go into rights and responsibilities, which are applicable here to all the programs. So we got it 4 pages shorter. One of those pages is a notes page. And then several of these pages in the appendix you don't fill out unless you need it. So, and again, I do regret that we did this so fast that we didn't have time to say, hey, what do you think? We're not finalized yet. What changes should we make? But in order to get this launched with presumptive eligibility and make sure it got developed and make sure we had translations in place, we did this faster. But hopefully using good information that had been developed in other states. And we are open to feedback, criticism, suggestions. It's just they won't be, the changes that would come out of that won't be made in July, but we will definitely take all that feedback and look for future changes after this. Yes, ma'am.
I can't really see that very well, but is there a place for you to go ahead and upload documents like bank statements and all those things that you require on the application?
So that is a really good question. And this is just the paper application. So since it's a paper application, you turn it in, and whatever you want to turn in with it, we would just take those and make copies and send it back to you. But all the things you can do at the Citizen Portal, you'll still be able to do. This is just for those who need or want to use the paper application, our attempt to make it easier on you. Okay.
In your appendixes there, do you still have the listing of documentation that's needed to submit with the application, like it used to be in the old?
No, we didn't
No.
take that out. We took that off.
Okay.
It is online, but it's not in the paper application.
Okay, and how about the asset disclosure form that they used to have to sign? Not
No, that
required
would be-
any longer?
That would be sent out with the notice, with the request for information. That would be sent out with that.
Okay.
Because it's only applicable to the certain
Yes.
categories. Yep.
Shannon?
I noticed that that's not exactly an all-conclusive list of the Medicaid programs in Arkansas. So if there's one on there that you're applying for that you don't see, is there space to write it?
Well, you could put it on the notes page, but the reason we don't include all the categories is because we don't expect people to know.
Okay.
What should I apply for? We're going to look and put, based on the information you give us, based on information we request from you after we get the application and based on information we get from checking our electronic data sources, we're going to give you the best coverage we can give you. We do put the specialty programs on there because it's not necessarily something we would know unless you told us that I need help, home and community, based waiver services, or I need services through the autism waiver for my child. But all the rest of the Medicaid, there's so many, we wouldn't list them all.
Okay.
But yeah.
I mean, the only one that I specifically am aware of and try to get people on is the Working Disabled Medicaid program, Arkansas's buy-in program.
The workers with disabilities?
Yes.
Yeah. Well, we can take that feedback back for possible next round to put on that specialty page.
Right.
Oh, that'd be great.
But we're automatically going to determine eligibility for that if you're working and you're disabled. Our system, we're automatically going to look at that to see if it's a potential category for you.
Okay.
Any other questions, comments, suggestions?
I've always kind of wondered about this, but I've just always done it the same way because, it's always, I don't know any different under the healthcare, applying for healthcare. My daughter already receives our Kids A. She has an autism diagnosis and she's under 8 years of age. So she would technically still qualify for the autism waiver. Is that correct? Like,
Possibly.
Would I be able to, like,
If you were to mark that on the application, then we're going to see if she can qualify. We'll go through the process. Now, autism waiver, you actually need to be receiving services by the time the child has the 5th birthday because it's a 3-year program. So,
okay.
and there's a waiting list too. My understanding, about a 6-month wait list. So really anyone interested in that program needs to apply, but by the time the child is 4, I would say, for sure. As soon as you know that there's an autism diagnosis, I would advise go ahead and apply then. But you don't have to know all of that to apply. You can mark the box, and then we'll take it from there, and then we'll communicate and let you know what the possibilities are.
That's what I was wondering. Like, what kind of services do you mean? Like autism therapy services?
In the autism waiver?
There is only one therapy that I know of that's for autism, which is the ABA therapy. Is there other therapies or other services that children with this diagnosis can get? Because I think that would be helpful to be on the application to say if your children requires this therapy, then you can apply. Or like, I would like to know the difference of like, and I think this is where I said in the past where a navigator would be helpful to help me determine like what service would be more helpful if we stay with our Kids A or if we apply for the autism waiver, because I've heard that it is a really long process. And if I can not go through that process, I'll just stay with our Kids A and not have to go through something that I'm going to get the same services that I'm getting now.
Well, and one thing I will also say is if your child's in our Kids A and you apply for additional coverage or specialty coverage, we leave that our Kids A open so that still continues. It's not, and we don't make any changes to that unless there's a determination for a different specialty program. And our Kids A, actually, children in that program get the full range of services that are available in the Arkansas Medicaid state plan. So
Okay.
you actually don't even need TEFRA if you qualify for our Kids A, because the same things that TEFRA would cover are covered by our Kids A. The autism waiver is specific, so it's different. But, children with autism, I think, it's not, they may get other kinds of therapy, not just applied behavior analysis, ABA. There could be PT, speech, OT. I mean, there may be other services. It really depends on what the child's needs are in that particular case, not necessarily the diagnosis.
Also, I always kind of thought the autism waiver was only for like
households that didn't already get our Kids A, like that didn't already qualify, like based on the income or based on other eligibility factors for healthcare, like our Kids A or Medicaid.
So TEFRA and Our Kids A have the same benefit package. So you won't get TEFRA if you qualify for Our Kids A. And one good reason for that is TEFRA requires a premium based on the parent's income and Our Kids A does not. So Our Kids A is actually better if you qualify because there would be less out of pocket. The autism waiver is a specific 3-year program. And so I think you either get Our Kids A or the autism waiver. I don't think I'll have to take that back and make sure.
Yeah, because all of the therapies my daughter is getting now, even the ABA therapy, are all covered under Our Kids A.
Right. Well, and that is a good point.
Yeah.
A lot of the therapy that is covered in the waiver is available in other categories. It's just a more intensive in-home program on the autism waiver.
The only thing I've always kind of wanted, I guess, has kind of encouraged me to apply for is the in-home services, because as of this year, my daughter's in-home caregiver closed our case and notified me that they had discontinued services for children and that they were only going to provide services for adults from now on. So that was the only, like, I would say, but it was specific to that company. So we would just have to go to a different provider.
Right.
Question from one of our online viewers. If you apply to the wrong type of Medicaid or waiver, is there a way the Medicaid will get you to the right program? It sounds like it doesn't matter really what boxes you check. It matters what information you put in. Correct?
Right, but if you mark AR choices, we're gonna specifically look at AR choices in addition to other things, right? If you mark nursing home and you decided you're not going into a nursing home, but you want the home and community-based waiver instead, then we're gonna make those updates as we interact and work through the application
Or if you mark one box thinking it's best for you, you may get an answer saying this is actually better and here's why. Correct? Based on what you put in?
Yes, I will say this though, if you don't mark any of the specialty boxes, we're gonna look at regular eligibility, right? We're gonna, for example, if you have a child that you think needs TEFRA and you don't tell us, please look at TEFRA, and you qualify for Our Kids B, we're gonna approve the child in Our Kids B without asking you the additional questions we need to ask about TEFRA. So in that case, you may get an answer that's not what you expected. You may go, but I thought we needed TEFRA, and it would be because we didn't know to look at TEFRA. But yes, as we go through the process, if you're not eligible, we're looking across the categories, definitely across all the regular categories. And then if you mark a specialty box, we're also going to be looking at specialty categories to see what a person is eligible for.
Like if you apply for AR choices, we also look at you for Medicare Savings Program. So if you're eligible for both of those, you're going to get both of them.
I just wanted to make the comment, while talking about the Workers with Disabilities Medicaid, Arkansas, Wisconsin, and Washington are the only 3 states in the nation that allow an individual who has a disability to work with no income cap, with no resource cap, and that will exclude a spouse's resources as well. But we have the most strict unearned income limit in all the nation as well. So I think that would be something to advocate for at the legislative session, to bring that unearned income cap higher. But I just thought that'd be interesting for you guys just to know.
Right.
All right. Ann has a question.
Well, I actually just have a comment. I wanted to say I appreciate the work y'all done on this. It's hard to see from here, but it looks a lot cleaner, easier. I appreciate all the work y'all did on it.
Thank you.
Thank you.
Just piggybacking off of what Jennifer had asked earlier. So the paper application mirrors what we'll be able to see online, correct?
Yes.
So does online still, at the end of the application process, give you the option to upload documentation? So the people who are doing paper applications and don't have the list of documentation that they submit, do they submit the application without documentation? And then when you come back with your request for information, are you giving them longer than 14 days to gather those documents? Because almost all of your requests for additional information have a very tight deadline.
So right now, our request for information is 10 days, and that may be changing. But we're waiting to see how some decisions that are being made at the federal level will impact that. But it is possible that that number of days are going to be increasing. We just need to see how things go at the federal level, because there is much discussion about changing a prior rule that told us to increase it by this 2027 or 28. So we haven't done that yet. So depending on how things go at the federal level and those decisions, it may be increasing based on federal rule, okay?
Any other? Yep.
But, and we will take a paper application if you attach bank statements to it or check stubs or whatever. We're going to upload it, right? But you can turn in a paper application with nothing, and then we're going to ask you for what we need. And the same is true at the Citizen Portal. You can submit your application electronically. You don't have to upload anything right then, because we will ask you if we need something. In fact, we would encourage people to go ahead and apply, and don't think you have to wait until you get everything you think we might ask you for together, because it can impact the date you become eligible. If you know, the retro, how far back we can go and things like that. So we're happy to get the information when you turn it in, and it can help make things go faster in the application process or the determination process, but you can turn in anything without additional information.
I just wanted to say thank you for doing this.
You're welcome.
So nice that I am a little bit excited about getting to fill it out. But I'm a goofball in that when you got to the page about notes, I thought it was notes for you guys to write. So you may want to put something on there that just says, please explain your, and then also to your point, and to further back up ball comment, I let my kids' Tefra renewal lapse. I forgot to fill out the forms and send them back in, but I called the office and talked to some really wonderful people who explained to me that if I'll just send one piece of paper in, it'll keep the system going, and that they will call me and let me or send me a letter and let me know what else I need. So that is, I wanted to let you know that is something that's working on your end. But then also maybe that helps you a little bit to know that as a user, it did happen.
So to talk about the list of things that we require, bank statements and things like that, that was actually discussed during the application redesign, and it would have required us to add another page. And so our goal was to, number one, shrink the application, number two, simplify it and remove everything that was not absolutely needed at a state or federal level. That was the reason we did not include a list of information that might be needed.
So to that effect, so like you were saying just a minute ago, to go ahead and apply without, so a lot of times when I'm applying for ALF and long-term care, one of the things that's been a huge stalemate for me has been like birth certificates, because I have these senior adults that haven't seen their birth certificates in 70 years, and we're having to hunt those down and sometimes wait months for them to come in. So if that is not something that is absolutely necessary for them to have to apply, but that you're maybe going to ask for, is all of the previous documentation absolutely going to be necessary to be submitted? Like copies of their driver's license and social security card and all of those kinds of things. If they're writing this information in on the application, do you actually need the documentation to prove that it's correct?
No, not necessarily. That list was things we might need. We don't necessarily have to have every piece of information. Right. And every person's situation is also different. Because we're gonna try to verify the socials electronically. We're gonna try to verify citizenship electronically. Have to have the birth certificate? for
No,
it?
I mean, if the only time we might request a birth certificate is if there's some sort of mismatch between the electronic information that we
Right.
receive
Okay.
and what the client told us. If someone was born in Arkansas, we most likely have the birth certificate
Right.
or the vital record information, and we would not need a birth certificate. And if a birth certificate, driver's license, whatever, has been provided previously, we don't need it again.
Okay.
Right.
That's huge.
Any other questions,
So
comments?
there are pros and cons to the list. There are.
So when we formed the Medicaid Client Voice Council, I relied heavily on what was being done in Colorado. They were a couple years ahead of us. I'm just curious, Brianna, when you looked at other states, what other states did you guys rely on or saw that was doing it, really well that we incorporated into our plan or our application?
Michigan was a big one for us. We really liked their application. We actually had meetings with them and discussed their redesign process. We looked at Texas, Indiana, and those are the states that our contractor works with also, and so they were able to reach out and get us in touch with the key people in those states.
Cool. Well, collectively, I think I can speak for the council. Thank you for the work you did in putting this application, simplifying it and condensing it and applying it to all programs. It's going to hopefully make life a lot easier for those who want to enroll or stay enrolled in these programs.
And I will say just one more thing before we move on to the next item. We wanted this to go live with the presumptive eligibility, but we also, a lot of states do a whole separate application for presumptive eligibility. And it's pretty short, pretty straightforward, and it's just for presumptive eligibility for pregnant women. So you still have to fill out the other application to get regular ongoing coverage. We wanted to have a simpler form, but we also wanted to not make people fill out two different forms to get the presumptive coverage for pregnancy. So now when you fill this out, if you're pregnant and based on what you've attested, you will qualify for coverage, but we need to ask you for something. We have to pin it to say, well, we're going to have check stubs after all. We're going to go ahead and approve that presumptive eligibility, but we already have the regular full application, so we don't, and that process is already moving along, and that was a lot of the thought that went into the way we did this. So we're doing presumptive, but if we can approve you in regular ongoing coverage, instead of that, we're going to, right? Because done. But if we need to pin that application for something else, we're going to go ahead and give you the presumptive eligibility, unless you've attested income that puts you way over the limit and you don't qualify, and then you'd get a denial. But otherwise, we're going to go ahead and activate that presumptive coverage while we send you the notice. And yes, it's a 10-day request for information, but when you contact us and say, I need a little bit more time, we're going to give you an extension. We just have to have communication in order to give that extension and give more time. And in addition to that, if you need SNAP, you can mark that box too, and you've got a full application going for the programs that we offer, just to help you get off to a stronger start with the maternal health care.
And if I missed this, forgive me, is this live already? And if not, when does it go live?
July.
July
You
1?
are seeing it first look.
So July 1st is when it'll be live? Okay.
It will.
All right. Mary, you stay up here. Brianna, thank you.
You're welcome.
Mary was also going to discuss with you a little bit before we get to our open discussion part of the meeting about the SNAP waiver. SNAP is not not a state program, but it's so closely tied to what we do. People think of SNAP, they think of DHS. So she's going to answer any questions or tell you a little bit about that.
All right, SNAP, you guys know it's Supplemental Nutrition Assistance Program. We do administer it here in Arkansas at DHS. We administer it in Division of County Operations. And we did, if you saw the news, Arkansas, we did submit a waiver federally, the program is funded and administered by the USDA, U.S. Department of Agriculture, Food and Nutrition Service, FNS. And the SNAP program's been around since it's over 60 years. And there are rules about what people can buy with the SNAP benefit now. And if you're familiar with SNAP, then you know that we determine eligibility, we determine a monthly benefit amount, and those benefits are delivered on what's called an EBT card, an electronic benefit transfer card, which works like a debit card at the grocery store, but it can only be used to purchase eligible foods for the SNAP program. So right now, you can use your EBT card for SNAP to purchase food that is not like prepared and ready to eat, right? Food that you would take away and prepare. You can also use your EBT benefits to buy seeds and grow your own plants, your vegetables, and things like that. You can't use SNAP for paper products. You can't use it for alcohol or tobacco products. Can't use it for pet products. So there are some restrictions now. But there are also some restrictions in, and I will just say this, shopping and the products that are available now compared to when the SNAP program federal rules were first designed, it's changed a lot. I mean, going to the grocery store is not the same trip it used to be in my lifetime. There's so many different products, new products, things that weren't even contemplated when the SNAP rules about what's an eligible food became law. But nonetheless, we have submitted a waiver asking for USDA FNS to approve us to change the definition of eligible foods in Arkansas and to eliminate the purchase of sodas, juice that contains less than 50% actual juice, unhealthy drinks, and candy including candy with flour in it. But we've also asked, and let us add hot rotisserie chicken, because right now it doesn't meet the requirements to be able to buy it with SNAP. And the soft drinks and sugary food, the candy, it doesn't actually, I don't know that we can say it meets the definition of nutritious and adds value to your diet, to the things that we all need to stay healthy, to grow. And we also have a large problem in the state with obesity and chronic diseases that are also tied to obesity and poor nutrition. And this was, one of the steps that we would like to take in order to limit those things that are not healthy and therefore incentivize purchasing of more healthy items, and then add something like rotisserie chicken, which, yes, it's a hot and prepared food, but you can grab that and add a few sides with it and have a nice healthy meal, and it might even be more healthy than some of, say, the frozen prepackaged products that you can buy with SNAP benefits now, because you don't have the choice of grabbing that hot chicken because you're in a hurry and you're trying to make nutritious meals for your family. So we did submit that waiver. We've had several meetings with FNS, very positive tone in those meetings. I do feel very positive that they will approve that waiver. They have also shared that they are in discussions with about 18 other states, and I can't name you all those states. I don't have that exact list, but other states are beginning to also submit waivers to change the definition of eligible foods that can be purchased with SNAP. And just today, we learned that Nebraska had submitted a waiver to limit sodas and energy drinks, and that waiver was approved by FNS. We learned about that this morning. So we also, in the waiver request, said we don't want to implement until July of 2026, because we know this is a process, and we want to go through this process. We've met with retailers. We've met with the Retailer Association. We plan to have additional meetings with the Retailer Association. We've met with the Beverage Association. We've done a 30-day public comment period. It wasn't required by FNS, but we did that nonetheless because we wanted people to have a chance to have their voice be heard and give us feedback. And so we'll be reviewing all of those comments as we go through this process. We have identified a company, it's called the GS1 framework. This is a company that works with manufacturers and on barcoding of products, the SKUs, the things that you scan. And we are very mindful of doing this in a way that is not overly burdensome for our retailers that accept SNAP, to be able to adjust to be able to identify the right products. And so we will continue to work through that process and develop our full implementation. And some of the feedback that we have gotten, part of what we will be doing is a robust education campaign. We don't want that education to have to happen at the register when you've got things in your cart. We want to do that ahead of time. So we have developed a draft plan. We'll be working closely with our comms team and with feedback from retailers about what they need to help educate ahead of time. And we will definitely be utilizing our field office staff. The SNAP program does require an eligibility interview with one of our caseworkers. So we will definitely be training them closer to the time. We're thinking about 6 months ahead of time before this change happens, to make sure they make that part of the eligibility interview to discuss these changes so that they know as they go shopping to use their benefits that, you can't use it for sodas, but you can use it for rotisserie chicken and you can't use it to purchase candy. And none of that to say that people can enjoy a soda if they want to or a candy bar. It's just, this is a move to restrict the purchase with SNAP benefits, not other funds. And the SNAP program, I think it may be the only food program that is federally funded that doesn't already have some additional nutritional requirements attached to it. If you're familiar with the WIC program, there are lists of eligible foods that you can purchase, and you can't purchase anything else. And it's about cereal with no sugar, and juice with, I'm not the WIC expert, but there are rules around the type of food that you can buy with WIC. The National School Lunch Program, there are rules that schools follow, to receive funding to help offset the cost of providing meals at school. The summer feeding program has rules about what type of food and the nutritious content of food that goes into those summer meal packages. So the commodities program, there are all kinds of food programs, and I think this change also kind of starts to more closely align SNAP to focus on nutrition and help us to reduce our risks for obesity, for diabetes, and for those chronic diseases that also cost all of us a lot more money when we need to have medical treatment related to those things. So that is the waiver we've submitted. We're still early in the process, and we'll be working hard as we go forward and to make sure that we implement this in a way that's thoughtful, that is not overly burdensome to retailers, to our clients as we move forward. Happy to take any questions.
Well, I'll walk over here. You mentioned the feedback you didn't have to solicit, but you did. What was some samples of the feedback that you got?
So there were some concerns of, not being able to purchase things, with SNAP benefits. There was some support for the program. There was just a reminder as you're looking at beverages to limit, please don't limit baby formula, which was not even something that was discussed. And there were just a lot of comments along those lines. Retailers, bear in mind the administrative burden of programming our point of sale systems. They've asked for support and a lot of information to make sure that they, comply with the rules of these changes as they're implemented.
I'm wondering if during the open comment period there was anything for households with feeding disorders or special diets, because I know that personally, I may possibly be getting 2 things taken away that we currently purchase, which is it's considered an energy drink, but it's an Aspire. It's a healthy energy drink, which contains taurine, which is a supplement that my specialist, it's a specialty supplement that I have to take for my diagnosis. And my daughter, because has a dairy allergy, and that's one of the main protein sources that children, like in the WIC program, but she's not able to eat like any dairy, cheese, or any milk product. I also buy her like the pea protein Cheetos, chickpeas, and other, they're considered Cheetos, but really they're made of plant protein. And I'm wondering, is this going to be under the category of junk food that's going to be taken away? Or are you guys going to just strictly go like, we're going to get rid of all the things that are in the candy food aisle, or just in the sugary sodas, and not like the sugary energy drinks that are just have no health benefits at all? Because it's going to put a very, very big burden on households with kids that have feeding disorders and have food allergies as well, because there's only a certain amount of foods that we can purchase and she can eat. And snacks being one of the biggest sources of protein for her during the day.
Well, and I appreciate that feedback. The waiver we submitted requested to limit soda purchases, juice that was less than 50% juice, unhealthy drinks, which is still being defined, so appreciate the feedback, and candy, including confectionery products that have flour. So that's what's been requested. We are still awaiting approval. Our request is still at undergoing federal review. At this point, we didn't request, to take chips off of the list. But I can't, tell you today exactly which drinks will be excluded and won't be excluded, because we're still working through that process. So I do appreciate the feedback there. I know energy drinks specifically as a group were not listed in the waiver, but we did ask for the ability to limit unhealthy drinks, and then the process of determining what is considered unhealthy still is happening.
So I had a question from one of our online viewers about summer EBT. Not the same as SNAP, but can you just explain how that works and if that falls into this at all as far as limitations on what you can use your summer EBT for?
Sure. Summer EBT is a program. This is the second year that Summer EBT has existed. Summer EBT provides a summer benefit to eligible children. It's $120 per child, and it is also delivered on an EBT card. And you can purchase it for the same. You can purchase with that Summer EBT card the same things that you can purchase with SNAP. Summer EBT is not SNAP. And to qualify for summer EBT, you need to either have received SNAP, T. There are certain categories of Medicaid that are automatic qualifiers for summer EBT, or receive free or reduced lunches through the National School Lunch Program, where you have actually had to apply for the National School Lunch Program. There are schools where no one has to apply and everyone gets the benefit of the National School Lunch Program. Children in those schools need to apply unless they've had SNAP, T, or certain Medicaid categories. But that is essential in children who've been in foster care, homeless families, runaway or migrant families, and Head Start. And early Head Start kids automatically qualify if they're school age between 5 and 17. So in a nutshell, that's the summer EBT program and the requirements. But yes, if this waiver is approved, then it would apply to what you can purchase with the summer EBT benefit as well, because it's delivered on an EBT card and you can use it to purchase what you can purchase with SNAP.
Any other questions? Okay. We did lose some of our leadership. We are going to have an open discussion. As usual, if we don't have the people in the room who can answer your question, I'm going to write your question down and I will get an answer to you and email it to the group so you'll all hear the answer. But are there any topics, Medicaid related, that we haven't discussed that are on your mind that you would like to pose a question about? Just raise your hand and we'll dive in. Randy.
Since y'all did such a great job with the new application, are we going to be able to apply those changes to your written notices and requests for information and notices of action and all those letters that
we want
that go
to?
out?
Yes, that's one of our next steps, is to use some of this design and thought process that went into the application to do in our notices. And I think I've mentioned before, we've had a work group working on notice language for probably a year. And we do have it on our roadmap as to make more improvements. I even want to use a QR code. Y'all seeing that more and more on forms?
Everything.
On everything.
Everything.
I want us to be able to use even QR codes so that if you want to turn it in and maybe you don't even have an account at our Access Arkansas so you can upload, that you could scan your QR code and it would give you a link to upload your documents if you don't want to mail them or drop them off at a county office or log into your account and upload them that way. So we do want to do the same thing with notices. We do. I just don't have a definite date, except that it's. We're starting at the end of this month, actually. Okay.
Is there anything that would be helpful for us to give you back, like, I have a stack of notices to like mark those up with suggestions
mark
or anything
up,
like that?
write on them.
Okay.
Email them to me or bring them and hand them to me if you have paper copies. We definitely will take that feedback.
You can also do that, or we as a collective group can come up with something to feed up to the Medicaid Advisory Committee that they will then work with DHS on. So we could do it that way as well. That's going to start in July, that process of feeding up that chain where we're going to take ideas from here, present them to the Medicaid Advisory Committee, and then they will be dealing with DHS leadership. They'll involve more voices, more opinions, differences of opinions and expertise. So good question. It makes logical sense that they would apply the application to the other forms. So good. All right. Anybody else have general questions, Medicaid-related questions? Yes.
I have a question about transportation, because I'm just now becoming familiar with Rock Region Transit and how limited it is on their route space. Do y'all plan on expanding the route for more people to have access that live in different suburbs of the city?
So we'll need to take that question back because unfortunately my expertise does not extend to all the details about the Medicaid provided transportation, the non-emergency transportation, but we can go back and ask the right people and get you a response.
And like you've provided like housing vouchers and food stamps and everything like that, I've noticed that there are a lot of healthcare workers these days that have temporary car trouble, or maybe they don't have their own transportation, but they still get rides to work. Sometimes those rides are not available, and they have to spend money on Lyft and Uber Could you possibly implement a voucher program for workers and their families to be eligible for something like discounted ride fare or ride fare that's even free?
So Jason, let's take that back as a suggestion.
Okay. It's in the same vein, so. Good. Anybody else? Any other Medicaid-related questions? Yes.
Now that we're talking about like the changes with the food choices and the SNAP program, you mentioned something about WIC already has, guidelines for the food lists that are approved. But I also wanted to mention that WIC also has a nurse that talks with the families. Like, let's say, to offer them alternatives when like a type of formula isn't suitable, or like something isn't suitable, they also offer alternatives. And I was wondering, is there any way, because I'm going to say personally, most of my SNAP benefits goes towards my daughter, because I have to buy her specialty milks, I have to buy her specialty most everything, and I have to get that from a specialty food store. Is there any way that like a voucher program or something like that can be added to the autism waiver that looks at additional SNAP benefits? Because I just always feel like I never get enough SNAP benefits for my daughter's food allergy and for her feeding disorder, her swallowing disorder. And I'm always like, what do I do? I'm always kind of like looking like, where else can I pull this? Like, where else can I pull from my budget to make up for this?
So we can definitely take that feedback as well. I don't have an answer for that today. One thing I would say is make sure when you are talking with your caseworker about SNAP that you talk about all of your medical expenses, because if you have someone who's 60 or older or a disabled household member, then you could qualify for a medical deduction, which reduces the income we have to count and can make your monthly benefit higher. So just always encourage people to make sure that you've talked thoroughly about things that qualify for the medical deduction to make sure that you get that. Okay?
All right. So July 8th, our next meeting. Jennifer, Brandy will attend both meetings. Do we have a volunteer to join them? We need to put 3 on each MAC meeting, 3 members. And if we don't have anyone here, I'm gonna reach out to the folks who aren't here to see if they'll be in attendance and if they can join. You want to do? Okay. And then I'll talk with you, since you live more than 75 miles away, about the possibility of spending the night, probably in advance of the meetings. Yeah. Yeah, there'll still be, these have always been open to the public. Now, we haven't had members of the public attend. A few times we did. Senator Hammer came one time, and some other members of the public have come, but these have always been open, and you can watch them online. But yes, we'll have spots where people can sit in the back if they're members of the public. All right. As always, I'll be looking for ideas for our next agenda. Think kind of big picture. What are some issues we'd like to feed up to the Medicaid Advisory Committee? What are some issues we would like to have them address from the perspectives that'll be in that room? Caregivers, physicians, past members, all those people in the Medicaid space will be able to take our suggestions and kind of either send them right up to DHS or tweak them, say, this is why this may not work, whatever they're going to decide. And so we as a body are going to have a direct line to the MAC. And so just think about agenda topics that we can percolate up up the chain. So appreciate all of your attendance. Thank you, especially those who travel great distances or face challenges with transportation. We appreciate you being here, and we will see you in July.